Hello, I'm Lisa Hepp, and I'm an epidemiologist at the Institute for Global Tobacco Control at Johns Hopkins Bloomberg School of Public Health. I've been working with the Institute for several years now on monitoring and understanding secondhand smoke exposure. Today we're going to be reviewing air nicotine monitoring and fieldwork, exactly how you implement such a study. So with this presentation, I'm going to be illustrating an example study of collecting secondhand smoke to monitor air nicotine, which is also referred to as passive monitoring. So this information is going to be used for field work when you're out in the field actually implementing the study and collecting the data. As an overview for this presentation, I'm going to give you a brief background on what secondhand smoke actually is. I'm going to highlight the steps necessary to follow when you're actually conducting a passive air monitor study or an air nicotine monitoring study, which will include your field materials, labeling procedures, data collection sheets, sample collection process, and a brief overview of analysis. We'll be utilizing an example protocol that monitors air nicotine in several different public places. So what exactly is secondhand smoke? Secondhand smoke contains gases and particles and is made up of mainstream and sidestream smoke. The mainstream smoke is the smoke that's actually exhaled by the smoker themselves, and then you have sidestream smoke, which actually comes off the end of the burning cigarette. Cigarette smoke itself and its cigarettes actually contain over 4,000 chemicals which are known to be dangerous and cause serious health effects. Secondhand smoke contains many of the same chemicals. So exposure to secondhand smoke, much like exposure a cigarette smoker may get, actually causes many diseases in children and adults, including heart disease and lung cancers, as well as acute respiratory illnesses. But why would you want to monitor secondhand smoke? These are the points that we feel are important, but you could probably come up with many others. So the first one here is important to document the distribution and the extent of secondhand smoke exposure in an effort to estimate perhaps the health risk that people are exposed to. The second point here, to motivate policy change or motivate policymakers to become aware of this particular situation of individuals getting exposed to secondhand smoke, is really important because it can have a great impact on society. It's also useful to monitor compliance. If you already have smoking regulations in place or smoking bans, you can use this type of data as evidence as whether or not people are obeying the rules or the regulations that are in place, or if they're effective or if they're being enforced. It's also helpful to monitor trends. So you can monitor before a smoking ban goes into place. You can monitor while it's being instituted or being put into place, and then afterwards to see how effective or if it is being enforced. It's also helpful to compare your buildings, cities, and regions to evaluate the impacts of these policies and whether or not any interventions that were put into place are actually reducing secondhand smoke in the air. In this figure, we can see how secondhand smoke from a particular source, such as a smoker, can lead to individual exposure or an internal dose in the human body. In this particular presentation, we'll be monitoring secondhand smoke in the air, but you can also monitor individual exposure through biomarkers or biomonitoring. So in the figure, you see source of secondhand smoke, which is actually, in this instance, a smoker, and how that can be related then to air monitoring and biomonitoring. So in air monitoring, the size of the room or the room volume, as well as the number of smokers, depends on the concentration that one person could be exposed to. It's also dependent on how long each individual is in that particular room and how much exposure that they would receive. So in this particular figure, you can see how secondhand smoke from a particular source, such as a smoker, can lead to an individual exposure as well as to exposure in the environment. And that's what exactly we're going to be measuring or looking at in this presentation through air monitoring. So you have air monitoring and biomonitoring or measuring biomarkers. In air monitoring, the concentration of secondhand smoke is not only dependent on the number of smokers that are present, but also on the room volume, and if there's any ventilation practices that might be in the room, trying to extract the amount of secondhand smoke. Each study should have some objectives and goals, and these are dependent on your particular study. So if you want to refer to your study plan for your specific objectives, that's the best idea. But for this particular example that we'll be using in this presentation, we've illustrated the objectives here. So the three main objectives of the study were to measure levels of indoor air nicotine in hospitals, schools, government offices, restaurants, and bars and nightclubs. We had also hoped to identify factors associated with different levels of indoor air nicotine, as well as to establish some baseline measures of secondhand smoke in order to support changes in policy and to also evaluate any changes that had been established prior and creating some sort of trends through. So these are the objectives that we'll be using in this particular study. So at this point, you may be asking yourself exactly how do you measure air nicotine? So in the slide, we see what an air nicotine monitor actually looks like. We have the diagram as well as a picture. In the diagram, you see that the air nicotine monitor itself is actually comprised of 3 different components. You have the filter cassette, you have the sodium bisulfate treated filter, as well as the windscreen. The air monitors are extremely fragile and need to be handled with care. For instance, if you're a smoker, you really need to make sure your hands are washed before you touch the monitors, as any nicotine residue that's on your fingers can accidentally be transferred to the filter, which would give a false reading before the air monitor is actually placed out in the field. But it's just a good practice regardless to wash your hands, even if you're not a smoker. The windscreen is extremely fragile, actually. That's the most fragile part of the monitor, and you see that there at the bottom, it's the last component. It's actually just a thin sheet of plastic, and what happens is sometimes people's fingers or thumbs will slip through there and rip the monitor screen. And if that's the case, we actually end up just throwing away the monitors because we don't know when that actually happened, so the filter could have become contaminated. So you need to be very, very careful when handling the monitor, especially the windscreen. In the picture, you can see a cap there. The cap goes over the top of the windscreen. So that's another example sometimes of how we can see ripped windscreen. So if you pull off the cap too fast, you can rip off the windscreen completely or accidentally, again, stick your thumb through there. So the cap is there to protect the windscreen and the filter from any sort of contamination from the ambient air or from when it's being stored before it's actually placed out into the field in the building or wherever you wish to monitor. You also see a plastic cup there as well as a plastic baggie. So the monitors are actually placed in little small baggies, and then the baggies themselves and the monitor are placed inside a cup. The cup has a lid on it as well. So you have the cup, the baggie, and the cap for the monitor to serve as a protective barrier from any exposure in the environment where the monitors are actually being stored at. Which brings up a good point. You need to make sure your monitors are stored in a smoke-free environment, just as another precaution, so that they're not accidentally exposed ahead of time. So going back then to the diagram, you have the filter cassette, and that basically houses all parts of the monitor, and that's a hard, rigid plastic, and you see there it has a little bit of a screw that keeps all of the parts together. And then that sodium bisulfate treated filter is actually where the nicotine attaches. So it goes through the windscreen and onto the filter. And the back of the filter cassette is also open, so that wind can easily go through the windscreen and all the way through the end. The windscreen's main purpose is to keep a constant flow rate through there, and the filter then again is to contain the nicotine so that it attaches to that, and the filter cassette is just the whole housing unit. You also see a clip there, and the clip is just for the purposes of attaching it out in the field. So of course there are some things that need to be taken care of before you can actually go out into the field. First, you need to determine which buildings, or the number of buildings even, that you're going to be collecting samples in. For this particular study, we decided to do a convenient sample, which would mean that it was a non-random sampling method, and we knew the type of buildings and the number of buildings that were feasible for us. But the number of buildings is dependent on the amount of resources that you have to carry out the study. So for instance, a large number of buildings within each location type may be feasible, depending on your financial circumstances and the amount of time that you have to devote to the study. In addition to determining the number of buildings and figuring out which buildings you're going to, you need to contact the building administrators. For this particular type of study, passive monitoring, you need to get permission from the building administrator or building owner or manager to place your air nicotine monitors. So it's helpful to send out a letter of request asking them to participate in the study. Once they've accepted to participate in the study and they understand what's going on, you should obtain an appointment so that you can review the practices of the study, and it's also helpful if you're going to be doing a building questionnaire. So that appointment, you can sit down with them and review any sort of questions they may have. You can get any of your questions answered, and you can have them fill out a building questionnaire. It's also helpful to sort of organize a route or to create a map of the buildings that you're going to be visiting, especially if you have a number of buildings that you're going to be going to in a large city, so you don't spend a lot of time in traffic trying to figure out how to get to the next building on time to make your appointments. And again, the last point here, as we mentioned earlier, it's really important to store your monitors in a smoke-free environment and at room temperature. We don't want the monitors to receive any sort of contamination or exposure to nicotine before they're placed in the field. Here we see a somewhat complex table of the number of buildings and types of buildings that we went to visit in this particular study. This is a table for each city. We went to multiple cities, so each city had a table exactly like this. We see that we went to hospitals and schools, government buildings, restaurants, and entertainment-type venues. And within each of the cities, we went to 5 of those. We went to 5 hospitals, 5 schools, 5 government buildings, 10 restaurants, and 10 entertainment venues. Go over to the next column. You see what says the location of monitors. That's the place within each of those buildings that we requested or thought was a good place to put the monitors. So for instance, in the hospital, we suggested placing a single monitor in the waiting room, a single monitor in the doctor's lounge, 2 monitors in the patient's floor, and 2 monitors in the cafeteria. Then you see the sampling time. We recommended 7 days, but this varied depending on the type of building. So as you can see at schools and in government buildings, a week really only consisted of 5 days, Monday through Friday. The reason behind that is that schools and government buildings weren't actually open on the weekends, so there was no reason to actually monitor on Saturday and Sunday. It was basically just a wasted period of time to have the monitor there, which would dilute the actual sampling or the collection of nicotine. So then you see the total at the bottom. So we went to 35 different buildings or venues, and we had 135 monitors plus 26 quality control monitors, which came out to about 161 monitors. We'll review exactly what is meant by the quality control monitors later in the presentation. This is just an example letter of requests that you should send out to obtain permission from each of the venues or building owners before you go and start hanging monitors. So in this letter, some ideal things that you want to keep in there are the name of the institutions that are participating in the study. So if your institution is Hopkins, such as the institution that helped with the study earlier, you would put that in there, but also other institutions that might be affiliated with it. For instance, if you're working with the Department of Health or the Ministry of Health, you'd want to list that up front so that the venues and the buildings, they have an idea of how important this study is and who's actually involved and any sort of reasoning behind that. In addition, you'd want to list out the study objectives and be quite honest with what you're doing here. And then go through some sort of study procedure, emphasizing that no one's really going to be hurt or involved. There's no human subject contact in this particular study. Those types of things should be listed out in the letter. As I also mentioned, it's ideal to create some sort of brief map. This is a nice map of the different locations that could be used to monitor so that you have some sort of route. So you see on day 1, you go to these types of venues in any particular order, and on day 2, then you would visit the other types of venues. But this can be done with just a hand map as well. Now we're moving on to more information about what needs to take place out in the actual field. So this is a list of the materials that you would need to conduct a passive monitoring study or an air nicotine monitoring study. Of course, you need your air nicotine monitors, any types of labels that you may have pre-printed that would go on your building questionnaires or any of your other data collection sheets, as well as your air monitoring cups, the authorization letter, which we reviewed now, your forms, such as I said, your data collection sheets, string or tape to help hang the monitor out in the field, scissors to help cut the string or tape if you bring that along. A tape measure is often helpful, as well as a step stool. The step stool is used to reach some higher places in case you can't get to them on your own or on a chair. It's important in any type of research or any type of function that involves a lot of different tasks to assign someone to oversee it. For a particular study like this, we'd like to refer to that as a project coordinator. And that person would actually store the monitors or be responsible for receiving them if someone was shipping them to you and making sure that they were kept in a smoke-free location. They'd also be responsible for distributing any sort of materials to the field workers when they go out into the field. So that would be your collection sheets, your monitors, any sort of labels. They would tell them exactly where they need to go out in the field and that map that they could have with them so they know the order that they should be visiting these places. They'd also be in charge of making sure that the appointments were scheduled and met and that the letters of request or authorization were sent out. A really big one that they need to be in charge of, though, is keeping track of the locations and of the codes. And by codes, I mean any sort of labeling scheme that is created for each of the buildings to help protect the identity of the buildings that are participating in the study. We'll review this later on in the presentation and in other presentations that are found on this website. They're also then in charge of collecting the monitors at the end of the study, ensuring that they are handled properly and put back in their bags and in their cups, and then preparing the shipment to the laboratory for analysis. And this last one, preparing the shipment, would also include making any photocopies for backup of the collection forms so that the laboratory had those for analysis. And this is helpful in case there are any errors during analysis that the people in the lab or the data analytical center can actually quickly review those sheets to see where any discrepancies took place and then contact the people who actually participated in the study if needed. It's also helpful then for the project coordinator to save any of those boxes that the air monitors came in originally before the study took place so that they could use those same boxes to ship back to the lab. Sometimes it's difficult to find large boxes to send 161 monitors back to a lab for analysis. So moving on, talking about labeling. This is an extremely important part of the study. Emphasis really needs to be placed on this, and it needs to be monitored and looked after in a very careful manner. If the labeling goes awry or does not take place in an appropriate manner, data analysis can become a major issue, meaning that we won't be able to link up any of the monitors that are sent back to the lab with any of the actual observation sheets or data collection sheets that were used out in the field. If those two things don't connect, then basically we have to throw out any of that data. So it's important to really follow these recommendations that we have outlined here. And again, we have another presentation on labeling on this website. So we want to use a unique code for your buildings that can be tied into your air monitors. The field worker will need to complete any additional portions of the labels, such as adding the building type or building number. So you want to make sure that you label everything that you can, but one thing you don't want to label for sure is the air nicotine monitors themselves. They'll actually have a 4-digit lab code assigned to them and put on a tiny sticker on the monitor. The reason you don't want to add another label to the monitor itself is because we recycle those monitors, and additional labels are often difficult to actually pull off the monitor, and they leave some sort of gunk or sticky stuff. And so if that's the case, then we end up having to throw away the monitor and won't actually be able to recycle them. So the monitors already have a label on them. There's no reason to put an additional label on them. But you can label the cap, you can label the bag, you can label the baggie that the monitors come in, and as we recommend, the label should be the same that's on any of your data collection sheets. It's often helpful to prepare all of the labeling of the field materials before you actually go out into the field. This saves time and it helps minimize any errors that might take place. It's also helpful to have a select few completing the labels or preparing the labels for the field. Ideally, this would be your project coordinator, but perhaps a small study team would be responsible for filling out the labels and preparing them for the field workers a day or so before they actually go out in the field. So here's our recommended labeling scheme. We're going to be using India as an example here. So you see at the top, we have country, city, building type, building number, and sampler code. The country number there, 356, is actually the United Nations assigned country code for India. Each country actually does have a United Nations country code, but this number could be anything that you wanted it to be, but we generally follow the United Nations country code scheme. For city, you see that we visited 4 different cities in India, and we just randomly assigned numbers to those cities. So for instance, you have Delhi is assigned 04, and Chandigarh is assigned 02. And as I mentioned earlier in the presentation, we visited several different types of buildings. We visited hospitals, schools, government buildings, restaurants, and entertainment venues. So each of those then was also assigned an alphanumeric code that corresponded with it. So hospitals were H1, governments were G3, entertainment venues were E5. So at first glance, this seems rather complicated, but once you start doing a few of them, you get into the routine and it actually becomes very easy and you see a pattern to it. Then each of the buildings are assigned a number, so that would correspond to the hospital. So we said we went to 5 hospitals in this particular study, so each hospital would have a number, for instance 1 through 5. So you'd have H1, O1, H1, O2, H1, O3, H1, O4, H1, O5. The sampler code is that 4-digit number that I mentioned that the lab actually places on the air nicotine monitor itself. So you would just jot down that 4-digit number that's on the monitor and fill in the label. Again, more information on labeling is available on the website. Here you see what we used as our data collection timeline. As I mentioned, we kept the monitors out in the field for 7 days, but based on your protocol, this could be different. You may have the monitors out in the field for 2 weeks or 5 days. So at day 1, you see we went and administered what we called the building questionnaire. So we sat down with a building manager or building owner, asked them a few questions regarding the particular venue we were in. We placed the air nicotine monitors in that building, and we filled out our observation or data collection sheets. On day 3 or day 4, sometime in the middle of the week, We went back to the building to ensure that our air nicotine monitors were still there, and we again filled out our data collection sheets. And then on day 7, we retrieved our air nicotine monitors, put them back in the bags, in the cups, and then took them back to the office, and also filled out our observation sheets for the last time. This is an example of our building questionnaire. It just asks some general questions, as I mentioned, about the venue, such as the ventilation system that might be present or may not be present, if there's any smoking policies that might exist in that building already, any type of advertisement of cigarettes or other tobacco products that exist, and any other questions that you might feel were pertinent. In this particular study, it was just a minimal 10-minute interview with the building manager, owner, or even a maintenance personnel. But when filling out the questionnaires, you want to make sure that you don't coach the person who is completing it. And by coach, I mean you don't want to lead them into answering a certain way. You want to keep the question as open-ended as possible with the choices and let them then decide what's the best answer. If you feel that they aren't sure of the answer and they're sort of guessing, you can always make notes on the side of the questionnaire, but never say something like, "Are you sure you don't mean this is the answer?" You want to just make sure that they give their honest opinion of what they feel is the best answer for that particular question. So as we mentioned earlier about labeling, it's important to pay particular attention to the gray shaded area in this particular questionnaire, which is at the top of the form. The labeling there, you see it says code, and you'd fill all of that in by either having a pre-printed label, which would be ideal, or having somebody hand enter all of those items in. The date's also extremely important so that we can keep track of when things were taking place out in the field. We use the gray shaded area routinely in all of our forms as sort of a highlight that you need to pay particular attention to this before proceeding with your form, your data collection sheet, or in this instance, the building questionnaire. So again, we have a gray shaded area here on the air monitoring sample sheet. This one is a little bit more complex because there was more information that needed to be collected, such as where in each of the venues the monitor was actually placed, whether it was in the cafeteria or the lobby or the bathroom, for instance. You needed to check those items off. It's also important to remember to check off whether there were any quality control monitors associated with the monitor that you were actually placing. And again, the label. The most important part of the form is the label here, to make sure that you get that correct so that you can match your air nicotine monitor with this particular sheet. So in the next section, we'll be discussing how you actually place the monitors out in the field, the different rules and hints that you should really follow to make sure you collect an adequate sample.